Hello. In this topic we will learn about cardiovascular diseases. So what are cardiovascular diseases? Cardiovascular diseases are diseases of heart and blood vessels. So if there is any disease which is related to heart or blood vessels, so we will group it under cardiovascular disease. The one very important cardiovascular disease is called coronary heart disease. So coronary arteries are arteries basically which supply blood to our heart muscles. So it means the blood carries oxygen and food to heart muscles through the coronary arteries. So any disease because of coronary artery blockage is called coronary heart disease, CHD. Okay, so here we will learn all the steps how the coronary heart disease can cause heart attack at the end. So first of all, what is a coronary arteries? What are coronary arteries? These are the arteries which supply blood to heart muscles. If these arteries are blocked like this, so you can see that the flow of the blood or the passage for the flow of blood is going to be reduced. So as a result, less blood will flow to heart muscles. So when the less blood will flow to heart muscles, so it means the heart muscles will get less amount of oxygen and food, and as a result the heart what will happen to the heart, it can be a heart attack. So as a result of less supply of oxygen to heart muscles, there is a possibility of heart attack. So again I am going to repeat. So if coronary arteries are blocked, so the blocked coronary arteries will supply less blood to heart muscles, and less blood supply to heart muscles will cause less amount of oxygen, and that will result into a heart attack. So there are two solutions to prevent heart attack because of the coronary heart disease. One is called stents and the other one is statins. So stents are basically very small tubes, tiny tubes which are inserted inside the coronary arteries. So like if this is an artery, so these tiny tubes are inserted inside the coronary arteries and these are called stents. So these stents and these tiny tubes basically support the wall of the coronary arteries and keep the arteries open. And keeping the coronary arteries open means that will reduce the risk of heart attack because the normal supply of blood will continue to heart muscles. But there are some risks associated with stents. The one risk is risk of infection at the site of stents, and the other risk is there could be a blood clotting near the point or near the place where the stents are inserted, and this blood clotting is called thrombosis. Second, there is a very small chance that there could be a heart attack during the surgery. But what are the advantages for having the stents? That these stents are effective over a long period of time, and secondly they protect and they lower the risks of heart attack. And the recovery time is short as compared to open heart surgery. The patients recover very quickly within couple of days. Within 1 week, they can go back to their normal job activities after 1 week. But the second option to prevent the coronary heart disease is statins. Statins are drugs. They lower the levels of bad cholesterol, which is called LDL. Because LDL, the large amount of LDL cholesterol inside the blood cause the blockage of the coronary arteries, because there could be fatty deposits inside the arteries, and if these deposits increase in size, they can further reduce the flow of blood to heart muscles. So reducing the level of LDL inside the blood can reduce the risk of heart attack. So there are other benefits as well. These reduce the risks of heart attack, reduce the risks of stroke. Stroke mean if there is a blockage of any artery inside the brain or the rupture, so as a result there is a possibility of stroke. And obviously CHD, they reduce the risk of coronary heart disease. And with the modern research, it is also proven that they also protect, these drugs, statins also protect from some other diseases as well. So what is their function? Their function is to reduce the level of LDL, which is a bad type of cholesterol, and they increase the amount of HDL, which is a good type of cholesterol. So HDL itself also reduces the amount of LDL. So what are the risks for the using statins? The risks are that these medicines are used over a long period of time, sometime lifelong, and the patients may forget to take these medicines regularly. So as a result, he will not get his cholesterol level going down. In the long run, there is a risk that these medicines can affect the function of kidneys and liver, and there could be a disease of kidney and liver, and may result, there is a chance that there could be a kidney or liver failure. And they also affect the memory, means in the long run there could be a memory loss, but the benefits outweigh the risks and the setbacks of using statins. So this is all for this topic of coronary heart disease. In the next clip we will learn about the other options of heart disease and its treatment. Thank you very much.